Witch Hunt News presents to you the documentary of Atropine and Scopolamine. Our underpaid employees have worked hard to track limited information about these two molecules. Please enjoy as we move on to talk about atropine.
This is the molecule atropine, which you might see in certain plants, but also in hospitals. In this documentary, we'll be going over the chemistry, the history, and how it's used in modern life. So please enjoy as we move on to the chemistry of this molecule.
Atropine is a chemical compound found in many plants and flowers, such as the belladonna flower. It is considered a poisonous drug because of its chemical structure and the effect it has on the body. It is a colorless crystalline alkaloid that has both basic and ester functional groups, so it can react with the acids to form salts like atropine sulfate. It is a tropane alkaloid made by esterifying tropane with tropic acid. There are chemical reactions that come together to make this atropine. Chemically, atropine acts by binding muscarinic acetylcholine receptors and blocking acetylcholine signaling. Atropine's structure includes a tropane ring that allows it to block acetylcholine receptors. This chemical shape lets it stop the deadly nerve overstimulation caused by nerve agents, making atropine a critical antidote in modern emergency medicine.
Atropine's earliest sighting dates back to the medieval period. Women would use extracts from Atropa belladonna, which contain atropine. The extracts would be used to make ointments that would be applied directly to their skin. Once the skin absorbed the substance, atropine would work its way into blocking the acetylcholine receptors, which play a part in controlling the brain, thus causing hallucinations and a feeling of flying. This is the reason why the Salem witch trials occurred when people reported flying at night on a broom. During the Renaissance period, women would use extracts from belladonna plants and use them for eye drops to dilate their pupils. Women found this to be a beauty standard at the time, thus directly putting the molecule atropine in their eyes. This caused hallucinations, light memory loss, and confusion. In extreme cases, vomiting, an increase in heart rate, and even death could occur. The reasoning behind all of this is that atropine blocks muscarinic acetylcholine receptors, which can be found in your eyes, and prevents the organ from performing its natural functions, thus creating irregular hallucinations and light memory loss. Vomiting and an increase in heart rate happens when atropine makes its way through the bloodstream, blocking the acetylcholine receptors that control the heart. Atropine coma therapy was used during the 1950s up to the late 70s to treat patients who dealt with anxiety, psychosis, or obsessive conditions. These patients would be put into a small coma by taking large doses of atropine. This was inherently dangerous, though. Patients could have hallucination, confusion, and circulatory problems due to atropine's nature of blocking acetylcholine receptors, which work with the central nervous system and regulating heart rate.
Today, atropine is widely used because of how it works in the body. Chemically, it blocks muscarinic acetylcholine receptors, which prevents the body from becoming overstimulated. The single action gets atropine several important modern uses. In hospitals, it serves as an emergency medicine that could raise a dangerously slow heart rate. During surgeries, doctors use it to reduce saliva and other secretions by stopping glands from receiving acetylcholine signals. Eye doctors use atropine to dilate pupils during eye exams. In addition, because some poisons and nerve agents overload the body with too many acetylcholine, atropine works as a life-saving antidote, carried by EMTs and even the military. All of these come from the same chemical ability, which makes atropine one of the most important medicines used today.
So far, we have talked about atropine's chemical structure and the effects it has on the body. It's shocking how such mass dilemmas and healing can both be caused by such a small flower. We've also covered the times the world has been affected by atropine, specifically in the medieval and Renaissance periods. You have been educated on the chemistry, history, and relevance atropine has on the world today. So let's move right into scopolamine and its effect on society. Although we will talk about scopolamine and its extensive use in the mid-20th century, it is also used today, mainly for medical applications. For example, it can be used during surgery, as healing lotion, and for nausea. Scopolamine is similar to atropine within their chemical structures and side effects, but for our report we will highlight both their similarities and differences. I hope you are as fascinated by these chemicals as I am. Scopolamine is a white crystalline alkaloid that, like atropine, contains both ester and basic groups, making it reactive to acid-base and hydrolysis reactions. This is because of its structure with an epoxy bridge on the tropane skeleton and an ester linkage to tropic acid. Its biosynthesis follows the tropane pathway. Functionally, scopolamine competes with acetylchlorine at muscarinic receptors to then inhibit cholinergic transmission. Scopolamine has a similar tropane structure, but includes an epoxic ring that lets it cross into the brain quickly. This chemical property causes strong amnesia and confusion, which is why it is misused in drug-facilitated crimes today.
A significant part of scopolamine's history lies within the early 20th century, where scopolamine mixed with morphine was used for pregnant women in labor to decrease pain and so women would have no recollection of their labor. If the drugs were prepared incorrectly, pregnant women were at risk for an overdose. The baby as well was prone to suffocation or asphyxia, which could lead to their death. This happens due to morphine and scopolamine blocking acetylcholine receptors, which work with the heart, meaning they regulate heart rate, and if the heart rate is slowed down and does not take in enough oxygen, the baby will not receive oxygenated blood, causing the baby to experience suffocation and die.
Scopolamine helped the military in World War II by preventing motion sickness for pilots and Marine soldiers. This happened due to scopolamine acting as an acetylchlorine agonist, thus blocking the nerve signals from the central nervous system that trigger nausea and vomiting. The military also used the molecule scopolamine as a way to get information out of hostages. At this time, scopolamine was known as a truth serum. Although the intake of scopolamine did make people talkative, it did not exactly mean people would be saying the truth. People taking scopolamine become really talkative by blocking acetylchlorine receptors, causing irregular thinking and a willingness to respond to commands or questions, even if they are just rambling. In the 1950s, scopolamine was used and can still be used for similar reasons today, as a hardcore drug to make people unconscious and take advantage of them during the state. Many crimes, like robbery and sexual assault, take place after people take scopolamine. This happens by the molecule blocking acetylchlorine receptors, specifically working with the central nervous system, and causing people to go into a state of unconsciousness or delusion.
Today, scopolamine is important because of how it works chemically as a muscarinic acetylcholine receptor blocker. This action connects the chemical to several modern issues. Medically, it is a valued treatment for motion sickness, severe nausea, and vomiting after surgery, and doctors rely on its ability to cross the blood-brain barrier to calm the inner ear and prevent dizziness. However, scopolamine is also linked to public safety concerns because of its strong effect on memory and confusion has led it to cases of misuse and crimes, especially in some countries where it can be used to incapacitate victims. This dual role as a trusted medication and as a substance that can be dangerous when abused makes scopolamine an important topic in modern medicine, public health, and safety discussions. So, a review of everything that we have learned about this molecule, from its chemistry to its history and to the modern issues connected to it. We hope that you learned a lot about our molecule, scopolamine. As we wrap up, we can see how a single compound can have so many roles, from a life-saving medication used all the way to a serious, dangerous when misused. Understanding it helps us understand both the science and the impact it has on people today. Thank you for joining us on our journey of exploring scopolamine as we move on to wrap up this documentary.
That is it, folks. We thank you all for watching our documentary and hope you learned a thing or two from these powerful molecules. Molecules play an important part in our lives, and we hope you realize that as much as we have. Thanks for watching!